Medicare Advantage plans are also known as Part C. They're also known as MAs, but they're most commonly known as MAPDs, which means it's a Medicare Advantage plan with the prescription drug plan included. Now, these plans are year-to-year contracts between a private insurance company and medical providers in your area, the hospitals and doctors, and together with Medicare approval, come together and they form a network. Now, these networks are very geographically specific, which means that a Medicare Advantage plan that's available in one zip code may not be available in the neighboring zip code. Now, if you decide that you would like to join a Medicare Advantage plan, keep in mind you do need to still keep parts A and B. Now, with the MAPDs, you will usually pay a lower premium or in some cases, a zero premium. However, you will have the responsibility of doing some self-insuring because there are copays and deductibles with a yearly out-of-pocket max somewhere in the range of $3,000 and higher. Now, the MAPDs are most commonly HMO or PPO plans. What this means is that if you go outside of the network to receive medical care, you will usually be billed much higher. One of the most important considerations when comparing different Medicare Advantage plans that are available in your area is how big is the provider network. Also remember that doctors can join and leave the plan at any time. It's called deemed daily. Now remember, I told you that Medicare Advantage plans are year-to-year contracts. Now, this being said, the plan you have one year could be very different the next year or no longer offered in your area. So what this means is that for folks that are enrolled in Medicare Advantage plans, they understand that they must compare plans and sometimes change companies during the annual enrollment period, which usually takes place during the autumn. Now, Medigap plans are also known as Medicare supplement plans. Now, these plans were standardized by Medicare, which means regardless of which state you live in, the plan benefits are going to be usually identical. Now, this makes comparing Medigap companies a little bit easier because all you really need to do is compare prices because the benefits are pretty much the same. The major difference between a Medicare Advantage and a Medigap is that the Medigap is a permanent fixed policy that you own on an individual basis. Now, Medigaps offer security in that you pay a higher premium up front, and then depending on the plan you choose, you'll have a lower copay or in some cases a zero copay. So, if you were hoping that we had an insurance plan that had both low premiums and low copays, so sorry, the health insurance world just doesn't work that way. I do need to slow down at this point because we are at the pinnacle moment in this DVD. The thought process when comparing a Medicare Advantage and a Medigap is simply this. How much of a calculated risk are you comfortable with taking by joining a Medicare Advantage plan, which means you'll be doing some self-insuring because of the copays and the deductibles and that max out-of-pocket? The folks that join a Medigap are willing to pay more premiums upfront and then, depending on the plan they choose, have zero copays or certainly lower copays than they would with the Advantage plans. Now, because the Medigaps are not HMO or PPO plans, there is no network, and you do not need to see you do not need a referral to see a specialist. Providing that your doctor accepts Medicare assignment, then Medicare will pay 20%, 80% of your bill, and then your Medigap policy will come in and it will pay all or a portion of the remaining 20% with any deductibles. Now, not having to stay within a network could be a consideration if you plan to travel outside of the network coverage area often. Medigaps stay the same each year and have guaranteed issue. The policy stays the same and in effect, providing that you are paying your premiums. If you're turning 65 or recently left credible coverage, there are no health qualifying questions. Now, if you have health issues, you may not be able to pass Medigap underwriting guidelines in the future. Now, that should be a major consideration when deciding between a Medicare Advantage and a Medigap. One of the main reasons that folks will choose an MAPD, besides premium price, is that the prescription drug plan is included with the medical insurance. Now, if you decide to go with a Medigap, you will need to purchase a separate Part D drug plan. Now, for some folks, picking the right drug coverage can be the most complex decision and costly if done incorrectly, especially if you are taking expensive medications, which could create a gap in the drug coverage called the dreaded donut hole. Now, when I'm dealing with a client in this situation, what I do is I will input their meds into the Medicare.gov website. Now, that website will point to specific plans that are available in our area, and then from there we can zero in on a plan and then go to that company website and then confirm the Medicare data. Now, like the Medicare Advantage plans, the drug plans are on a year-to-year basis, which means during the autumn annual enrollment period, we'll need to go back and research and sometimes change companies. In simple terms, there are 4 drug tiers. There is a generic, preferred name brand, and specialty meds. If you are taking several medications, we will need to do some research and see, number 1, does the drug plan have a yearly deductible? How much is the monthly premium going to be? Are all your medications on the formulary? What will your copay be for each of the individual meds? And then finally, what will your total yearly out-of-pocket drug costs be? Now, if you are not taking a lot of meds, you may opt not to buy a prescription drug plan. Now, there are 2 risks with this thought process. Number 1, if you need to start taking an expensive Tier 3 drug in order to maintain a comfortable quality of life, the cost of self-insuring could go into the thousands. Number 2, if you decide that you do not want to enroll in a drug plan during your initial enrollment period and then decide that you want to at a later time, then you will have to pay a penalty. In simple terms, you will have to pay a penalty somewhere between $30 to $40 per year, which will be deducted directly from your Social Security check on a month-to-month basis. It's not like a penalty from the IRS. We're talking dollars per month. But if you've gone several years without a drug plan, then yes, those dollars could add up. For folks that do not use a lot of medications, they may buy a drug plan and, like most insurance, hope they don't use it. Or they may opt not to buy a drug plan and just pay for their medications out of pocket, or perhaps use a prescription drug card and just hope and pray that they stay on generics. So, recapping the MAPDs and the Medigaps. The Medicare Advantage plan is ideally suited for folks that believe that they are going to stay in good health as they age. They know that they're going to be paying lower premiums, in some cases a 0 premium, but they accept that they will have some self-insuring because there are copays and deductibles and a max out of pocket. They know that they have to stay within the network, and they accept that the plan is likely to change on a year-to-year basis. One of the great things about the MAPDs is the drug plan is included. Now, for folks that are on the Medigaps, Medigaps offer security in that you have fixed medical expenses by paying more in premiums up front, and then once again, depending on the plan you have lower or zero copays. They like the freedom of choosing their own doctors, and they like the fact that the plan is not likely to change on a yearly basis. If you decide to go with a Medigap, remember, you will need to choose a separate Part D prescription drug plan. All right, we are now at the end of our DVD. And as promised, I have now given you everything that you need to know about Medicare. Well, okay, maybe not everything, but I certainly would like to think that you know more now than you did before our DVD began. Actually, I'm hoping that you do have questions and that you are going to call me so that we can sit down and have a face-to-face visit. You now know that Medicare Part A covers hospitalization and with 3 benefit periods and goes up to 150 days, and that skilled nursing goes up to 100 days, and that both the hospitalization and the skilled nursing come with some pretty steep copays. You've learned that Part B covers medical expenses, people, and services. After the $140 deductible is met, you would be responsible for 20% of the bill. Now, I'm hoping that the above-mentioned copays are a moot point, because after watching this DVD, you've now come to agree that Medicare doesn't cover everything and that there is a need for additional insurance. You now know how to weigh the difference between a low premium Advantage plan as compared to a Medigap policy that has higher upfront cost but lower or zero copays. And if prescription drugs are causing you some confusion and some concern, then perhaps it is in your best interest to give me a call so that we can set up a face-to-face and do some professional consultation. Now, I do understand that some of you watching this DVD may have already enrolled in a program. Perhaps the information that you gained today helped confirm that you did pick the right policy with the right agency. Great. Remember, I said my mission was to help you feel more secure with the decisions that you make. Now, for some of you that are feeling a little bit of uncertainties, perhaps buyer's remorse, the good news is that Medicare is very forgiving within your first year of enrolling. And oftentimes, you do have choices if you want to reconsider your initial decision. We all try to be proactive with our major purchases, but sometimes we do need to get some professional guidance in order to feel comfortable with the decisions we make. We have business advisors, medical professionals, skilled tradesmen. These are people that have earned our trust. I have the education, I have the experience, I have the resources, and most of all, I have the compassion to earn that trust from you. The first step is for you to give me a call so that together we can set up an appointment either in your home or in my office in Nampa. And then together, as a team, we can pick the right policy with the right insurance company. You'll be part of an insurance agency that has over 30 years servicing the community and has a reputation of being there when you need us. And you'll have a friend in the business that focuses on senior health insurance needs and is always a phone call away. I hope this DVD was informative. I also hope that I can be of service to both you and your loved ones. I look forward to hearing from you.